Hi, I'm Dr. Peacock. I want to go over with you a minimally invasive surgical correction of a bunion we performed 3 months ago. Today's video is going to be both academic and also a testimonial. We had somewhat of a challenge with her foot. If you look here, you can see she has a fairly significant IM angle here and a fairly large bunion, as well as a lot of arthritis in the joint, which have made this deformity painful for her. If you look at the lateral view, you can see she also has some lipping of the bone here, which attributed some of the hallux limitus. What we did with her, we did a minimally invasive surgical correction percutaneously, and we did this by pinning the metatarsal osteotomy and bending our K-wire so that it kind of establishes some correction of the pasa as well. One of the things I want to show you is in this particular cut, what we're doing here is we're combining the Isham-Reardon cut along with the Wilson to allow us to maintain first metatarsal length. And the reason we use the K-wire is with this cut, you can get dorsiflexion of the first metatarsal head if you don't pin this particular osteotomy. It allows for correction of fairly significant bunion deformity, even if you have a high IM angle. So we're now at three months today. I'll show you what the x-ray looks like now. Here we are, here's the x-ray now. One of the things I want to show you is if you look at the first mat compared to the second mat, so we didn't get much shortening. The way we cut this is we correct pasa and we also move the bone laterally and also distally. So it allows us to maintain correction in that. You can see we've also got some opening of the joint, and some of the arthritis she had before is now beginning to actually resolve as well. And here's her foot pre-op. I want to show you the significance that we got correction-wise. Here's how her foot looked at first presentation. You can see she has some venous stasis issues, not a very good candidate for base wedge osteotomy. Now here's her foot today, and I want to show you what we got. Got a fairly good correction. You notice her toes now it's not hitting her second toe, and even with her foot loaded, we've got fairly good range of motion with no pain. So this is only 3 months later. She has the same deformity in her right foot, and she told me today she's ready to get this one scheduled. So it looked about the same, maybe a little worse on the left foot clinically than her right foot. So here's our patient. I want to introduce you to her. How you feel about your bunion? It's been a good experience for you? Or?
It has, and my left foot does not bother me anymore. I'm glad I've had it done. I'm looking forward to having my other one done.
Let me ask you this: as far as your post, now we did this in the office under local anesthetic, which is a very important thing. You don't have to be put to sleep to do these different procedures. How much pain did you have with this post-operatively? How many days did it hurt? Was it more than a week or about a week or so?
I'd say about a week.
Okay.
Yeah, about a week.
Okay, so for this patient, for a fairly significant bunion correction, she wasn't off of her foot. We did percutaneously pin her osteotomy, and we're able to correct this in the office without having to go to the hospital and be put to sleep. So after the 3 months is up now, we're going to schedule her today to correct her right foot in the office as well.